I am joined again for 2026 by Richard. Hello, Richard.
It's been far too long, but great to see you again.
Do you know, it's been a very long time. Lots of reasons, your end, my end, and everything else. But we're back, which is really exciting. As we go into a new year, maybe it might be good just to briefly touch on not why we have these conversations, but why am I having these conversations with you about medicine? Where do you fit into that?
Well, thank you very much. Well, I'm a relatively newly retired GP, actually now 6 months. My goodness, the time flies. But I still have an interest in medicine, and I tell you what, you never completely retire as a doctor because people are always asking you questions. The only question is whether A, you're bold enough, and B, actually have the answers. But in fact, I went into my practice today because a friend of mine said, "Oh, I need a referral for X," and it's fine. I don't know who the right person is, but I shall find out. So that's very nice. But what I like about this program is that it's very much medicine from a Christian aspect. What is God teaching us? So it's a little bit about informing people. Often I have to look stuff up myself, as I have done today. But also, what is God saying? What's the Christian angle on this? So that's why I like speaking to you. Apart from that you've become a friend over the last 2 or 3 years.
Yeah, I know. I was having this thing the other day. I was sat at a conference, Jay Jones Evangelist Conference. Katie Mack, who's one of our presenters from Monday's morning show, she was in there as well. And as I was just sitting there looking, scanning around the room, 300 people from all around the world, literally, there are one or two faces I knew. Of course, Katie Mack, I know, one of my presenters, and thinking, I didn't know her 3 years ago. I didn't know her a year ago, actually. And there's people like you. I didn't know you. I didn't know you 3 years ago. And I love how God has brought all these different people into our lives. Dan Rouse, who's another morning show, or Jonathan Brewer, who's starting a morning show. I didn't know these people, but God's brought these people into my life, and hopefully I'm brought into theirs as well. And it's just lovely to see, when God's family knows no bounds.
It's interesting you say that because this phrase, isn't it? Oh, the smallness of all the Christian world's very small. I don't think it is that. I think the Christian world's actually quite large.
Yeah.
But what God is doing is He connects people. And I was just saying to you before we went on air that we're trying to set up this huge mission hub. I mean, it really will be a big one in Thanet, 6.5 acres with the most enormous building, which we're trying to get hold of. And it's quite a business. But lots of people are coming out of the woodwork. Well, they're not just coming out of the woodwork. God is drawing them towards this project, linking people together. And I'm thinking, oh, that wasn't an accident. Oh, that was useful. Oh, thank you, Lord. That's what God does.
Yeah, totally. Right, before we get on to what you wanted to talk about, I had a question from my wife, actually, for Anne Lord Jackson, because he went to the cinema, and it made us think a couple of things. Now, I'll be talking to Anne about this from a sensory health perspective, but another part of this is about dopamine, which I know the name of, and that's about it. But anyway, we went to the cinema. It was great. Someone gifted us some money. We went to the cinema as a family. And obviously, it's a PG film that we chose to go to. And before the film comes the adverts. And they're generally going to be PG, a U, maybe a softened down 12. It's very much similar. One of them was a cartoon. And it got so bad in the advert, I had to turn away because I was starting to feel physically sick. Why? Well, it's a cartoon. There's nothing disgusting. But the scene length was maybe half a second. It was one scene to another scene to another scene to another scene. And it was so fast, I literally started to feel sick. Now, I've talked to Anne Lord Jackson in terms of sensory health, how my interactions with TVs, whatever screens. But one of the things somebody said was, that's because of dopamine. It's to try and addict children to a TV show, series, film, because it's so fast moving, it gratifies the brain, releases dopamine, and that's why they're doing it. And I thought, I have no clue whether that's true or not. So I know a man I can ask, one, what's dopamine? And two, is that even a thing?
Well, dopamine is a very important chemical in the brain. Very important in mental health, I might say. Whether that is a dopamine effect, I don't know, because actually my response to these things, like you, if I get fast moving images going across the screen, it makes me feel a bit sick. Now, is that a thing to do with age? You're a bit younger than I am, but is that an age thing? How come it seems to attract children and maybe put off older people? That's one question in itself, which I think is actually quite interesting. But I think you're right. They do it because it attracts people and wants them to, what's the next image? What's the next image going to be? So it's somehow attractive. Whether that attraction involves dopamine as a hormone in the brain, I don't know. I really don't know. I'd have to look that one up. But it is an interesting phenomenon that is clearly a deliberate policy, deliberate ploy, which maybe only works with the very young. Perhaps because their eyesight is quicker than ours. They can see an image and then see the next image and see the next image. Whereas as you get older, it just becomes a blur. You just can't get it in time, and then it's moved on. I don't know, but yeah, dopamine's a very, very important chemical in the brain, and it's, without it we run into all sorts of troubles like Parkinson's disease. But hugely involved in mental health. I wouldn't be surprised if there was whether it's dopamine or one of the other steroid type hormones that is elevated as a result, something that is involved in addiction. But I'd have to look it up.
I mean, I was just fascinated. This was very definitely a cartoon for, I would guess, under sixes by the look of it. It felt like a kind of, small toddlers kind of cartoon. But I know that, like on a roundabout, for example, if you've got a child in a roundabout, they can go swinging, round and round in circles. They can get off and go and run. An adult probably will want to stop, fall over, and then throw up. So I know there are differences between adults and children, but it got me thinking. I remember, like, the way we were, or any of the older films, there's such long scenes that are drawn out beautifully, and characters come in and they go out again, and somebody comes in, and you can have these continuously long scenes. Singing in the Rain, some of those scenes go on forever, and yet you get James Bond. Oh, isn't it amazing? It's a long scene introduction to one of the films. Well, it's not that special because that used to be normal, and now it's sort of a special thing. But it got me thinking about kind of addictive behavior in terms of screen time and all the rest of it. New Year's resolutions, less screen time, all that kind of stuff. So having been to the cinema with obviously, huge screen, it's a different effect from a TV anyway, or a tablet, what have you. But it just got me thinking, is dopamine actually creating addictive stuff going on because of how they're doing it?
Thing, whether dopamine is involved is the only question. Interestingly, I just read in the paper yesterday that Wimbledon, and I hope they don't, are thinking of changing the coverage on the BBC and the way it's shown. Rather than show a 4-hour tennis match, we'll just have a little clip here, a little clip there, maybe 6 matches going on at the same time on one screen. And the paper was saying, no, what we love about Wimbledon is the timeless element. It's always been like this. It's slower. You can relax, just one game at a time. Just because the Australian Open is trying to do some of this whiz-bang stuff at the moment, and the other ones are thinking about it, Wimbledon, stand secure. Stick to what you're doing. We're not just sticking the muds here. People value it. They like the fact that it's different and slow. And if you don't like it, well, you can probably watch another match later. But this idea of constant sensory input, which Anne-Laure Jackson will know all about, it's not necessarily good for us, and it doesn't make us feel any better. Whilst watching a long, slow tennis match, it's very relaxing.
It is. You see, you're sitting there. You haven't got 18 cameras pointing at you, and every word it's got a different angle of your head. It's like we're looking at each other. We're not moving. It works.
But I do apologise for what you're having to look at.
Well, yes, likewise. Okay. Right, Richard, what have you brought for us today?
I like to bring stuff from the paper. And in fact, I've struggled to find anything good medical until the other day. There's lots of consistent things that are on time and time again. So talking about weight loss jabs or talking about vaccines, that sort of everyday stuff. In fact, I think I'm going to write something in the magazine on Ozempic because it's such an important subject. But I did spot one thing in the last week, which probably most people will have missed, but it's really quite important. So here it is. The prompt was initially from the Times newspaper, but then the BBC did a short report on the same subject. And I've often said, Andy, when the same thing comes to me twice, whether you send me something or I read it or it's on the telly and in the newspaper, hang on a second, I need to take this seriously. And it's this: why are more young people getting bowel cancer? And they've come up with an interesting theory, which I shall allude to at the end. Anyway, got my medical juices flowing. Now, some of your listeners may know that I've got an interest here. I had bowel cancer in 2011. Mine, I might say, declared itself when I was 51. Still relatively early, because like most cancers, many cancers, but most cancers, they increase with age. I was off work for just under a year. I wrote a book about it called God, I've Got Cancer, looking at cancer generally, adding in my own experiences. And also, what does it say to us as Christians, and trying to lead people with a terrible disease towards faith. That was the plan in the book. Now, my cancer at 51, I was part of the 89% of people. 89% of people with cancer get it over the age of 50 in the UK. In other words, only 11% under the age of 50. That's where cancer occurs. It's an older person's disease. And under the age of 25, it's 1% of all cancers. So 1%, 0 to 25, 10%, 26 to 50, and the rest after that. So I got it relatively young, but I was into the 50 onwards bracket. So if young people are developing increasingly bowel cancer, which is an old age disease, it's both a worry and also an odd development. Why is that the case? Now, it's not going to shift the percentages much because the majority of bowel cancer still happens in older adults, but there has been a 75% increase in the under 24s, this is young, getting bowel cancer since the early 90s, with scientists questioning why. Now, there's many reasons which are the same for older people. A combination of genetic and environmental factors. The latter one's particularly important. We're too sedentary. Our diet is poor. That was probably influencing me. High in processed foods, low in fiber, obesity. There's lots of reasons, but no single cause, unlike, for example, lung cancer caused by smoking. Okay, you can get lung cancer if you're unlucky as a non-smoker, but the vast majority is caused by smoking. But there's something else potentially going on here. Now, I remember, Andy, when I was going back to the early 1980s, when you were still in shorts, perhaps long trousers, just about. In the early 1980s, I was a medical student. And one of the things I really enjoyed was going to the pathology lab and looking at specimens in glass jars preserved in formalin, because you could see the diseases. You know, here's an organ, here's a liver, here's a kidney, here's something else. You could see the diseases. It brought to life what we were learning about. Now, this BBC article I've just read pointed us to the UK's top colorectal hospital, which is St Mark's in London, famous for so many years, the National Bowel Hospital. And it's apparently got a unique collection, as you might imagine, of tens of thousands of cancer specimens, bowel cancer specimens, which they're now beginning to analyse because there's some new scientific advanced techniques. And the idea is to say, looking back over all these specimens, what caused each individual cancer, not just what's the overall cause of bowel cancer, each individual one, and therefore what might have changed over the decades. And to illustrate the issue, the BBC highlighted one young female patient, Holly, who was bloated and had weight loss, unsurprisingly at her age of 23, put down to irritable bowel syndrome, IBS, before unfortunately her advanced bowel cancer was diagnosed at 23. Now, I'm very pleased to say she's done well following intensive chemo, and she's been cancer-free now for 3 years, so she's 26. But she does have a stoma. She's had to have all this treatment. She gets very frightened and struggles to understand why. Why so young? And of course, she needs regular monitoring. So what's going on? Well, scientists have postulated various other things beyond sedentary lifestyle, obesity, and bad diet. Could pollution be responsible? What about microplastics in the diet? We've all learned we've got a teaspoon or so of microplastics in our brain. Well, if that's the case, that seems quite a lot. But could that be responsible? Well, the leading idea at present is that neither of these are responsible. Instead, they have found preserved in this paraffin wax, so a lot of their specimens aren't in formalin, but in paraffin wax, alongside these cancer specimens are gut bacteria. And they've sent samples to the Institute of Cancer Research for molecular analysis, and they found that the different causes of cancer leave different marks or signatures in the DNA of cells that become cancerous. So the cause of cancer is affecting the cell's DNA. And it is now thought, and at very least it's possible, that bacteria are responsible for this 75% increase in young bowel cancer patients, with one in particular blamed. Now, most people, if they're asked, oh, tell us the name of one bacterium, many people will say E. coli. Well, you're quite right. E. coli is being blamed. It's responsible already for so many diseases, UTIs, it's the commonest cause, food poisoning, pneumonia, septicemia, meningitis, gallbladder disease, prostate inflammation, so many things. But one variety, and there's hundreds of varieties, but one variety of E. coli has been found, but now it's been found to live in the bowels of young people that wasn't there before. Can you imagine the excitement in the scientists? This is why they live their lives. This is why they get up in the morning. You know, the investigators must have been so excited. And here's the postulation. Could it be that toxins, and E. coli is well known to release toxins, could it be that toxins released from this one variety of E. coli could damage the DNA inside bowel tissue, turning it cancerous? So, as ever, there's more questions than answers in the early stages. Why, for example, are these bacteria more common today? Or is it just that we're finding them? But it seems that they couldn't find them previously, and there they are now. There's no answer to that yet. But I wanted to bring it to Pure 247's attention, because this is very interesting. It's potentially highly significant, because if we can find the signatures of these bad bugs, then perhaps these sort of troves of wonderful pathological specimens will not only teach us about disease from the past, but may contain answers relevant to our young people's future. So I thought I would just leave it there, but yeah, potentially very interesting.
Yes, very much so. My brain immediately thinks it can't be environmental, because if it's environmental, that would affect young and old. If it was the water supply, young and old, I can only think it's got to be the things that they are choosing to do, which then makes you think it's got to be the diet that they have been having, perhaps. My brain straight away goes to energy drinks, because I don't know, high levels of caffeine that's too much for the body. Is that creating a little environment? Because I'm not a scientist or a doctor, as you can tell, but I'd be thinking, well, where does E. coli flourish? What makes it want to grow the best? What's the best fertile ground? What can we create? Looking at food, because it's got to be.
Maybe lifestyle, perhaps. What I want to do, I'm going to keep an eye on this one. Yeah. And so when I find some more updates, when the paper tells me, or BBC or someone else tells me, oh, look what we found, I'll bring it back to the program. Because at the moment, I'm just bringing it to as an interesting thing. What we do know is that, bowel cancer in young people, that's very bad luck. This is an older person's disease. So, very important to look into why, because as ever, there may be something to prevent it. If so, fine. Maybe there'll be a vaccine against E. coli in the future. I'm just guessing, but yeah, this is well worth looking into. So I'll keep you updated.
Yeah, it hits a nerve for me though, because I've been told by two cardiologists, so heart doctors, basically you're far too young for the issues you've got with your heart. You're about 20, 25 years too young. I mean, that's nice. It's not really. I don't want to feel special there.
Yeah, you'd rather be special in another way.
Yeah.
Good point.
But yeah, it's interesting. I mean, when you have trends that are that high, you've got to start asking questions, because that's got to be something that they have either done or not done, that people who are a generation 2-3 generations older have done or not doing. There's got to be a cause and effect. If it was 2-3%, you might even ignore it, but 75% that is a huge figure.
Yeah, absolutely. It's so much higher, and shocking. And obviously, but what they would have found is they would come across one or two people like Holly getting bowel cancer young, and then suddenly they'll talk to their colleagues. Oh yeah, we've had a couple more young ones than expected recently. Hang on, is something going on here? And then the wheels get turning.
I mean, like you say, I can imagine the scientists would have been, nobody wants to know. If you're 23, 24 with that, you do not want to be special. But the scientists would have been excited, because it just feels like something we can actually fix or correct and prevent.
And also, as a GP, okay, I'm now retired, but say the next person comes in with almost certainly IBS symptoms, I'd be beginning to think, am I 100% sure? Because we're learning that more young people are getting bowel cancer. So before just simply say, oh, it's IBS, and all we do with IBS is treat the symptoms, because it's a functional disease rather than a structural abnormality. You need to just think, hang on a second, could anything be else going on here? So it just keeps GPs, hopefully, and other doctors alert.
I'm genuinely fascinated. I replayed the interview we did last year. Well, it's not a great thing to say, is it? It's January. We did last year about screening, and whether the approach of almost kind of, you must have breast screening for cancer, we must do prostate screening. Is that something that we should be doing? Because it gets me thinking about how we approach life, how we live the life that we have. I said to you that there are certain things about the heart struggles I've got. I want to live while I'm alive. I don't want to think, oh, I'll just take pills for the next 40 years. That's not a life. I mean, if I've got no choice, I've got no choice. I have got a choice. Maybe it's a good or bad choice. People might agree or disagree. But there are certain decisions I've made based on the fact that while I'm alive, I want to live the best I can, because I still remember this guy, fully healthy, cyclist. I've used this before because it's so important. He lived till 60, 65 or something, proper professional cyclist. Then one day drops dead with a heart attack. with something that wasn't health related. It was just one of those things that happens. And he'd never been ill. And it just reminds me now, there's no rhyme nor reason sometimes in how we can do stuff. But if we don't live the life that we have that's available to us to live, then we're just going to speed up depression, mental health issues, physical health issues.
Sure, absolutely, yeah. Making the most of our time, and I guess that's where the scientists and the really clever doctors at the top end of the spectrum want to help people like Holly live the absolute best that they can, and also to prevent more Hollies in the future. So I think science used well is very exciting, because it's not only helping people now, but trying to help people even more in the future. And it is, when you discover something like that, goodness, they must be excited.
Just being thorough, what's a stoma and what's IBS?
Stoma is when you bring the bowel out to the surface because there's been a problem with the bowel. Say you've had a major bowel operation, and you can't bring the ends together, or it's not safe to do so. Many people, so for example, with a low bowel cancer, like I had, although I haven't got a stoma, I'm pleased to say, many people, they remove the whole lower part of the bowel, and then you're just left with the upper part of the bowel going nowhere. It's brought out to the surface, and then you have a bag. So the poo is collected on the surface of the abdomen. So that's a stoma. You can have urinary stomas as well as bowel stomas. And then IBS, irritable bowel syndrome. So where particularly in young people, the bowel just doesn't work well. You get very gassy. You get either constipation or diarrhea, or both alternating nausea. It's just cramps. It's just a nasty disease where it's not working very smoothly. But you take the bowel out, say, look under a microscope, it looks entirely normal because the structure's fine. It's the function that's misbehaving. So it's called irritable bowel is a good description. It's an irritable bowel.
You see, I've heard of stomas. I had no clue what they were, which is why I like to ask questions.
Yes. And sometimes if you have a major bowel problem, say you have a burst bowel, usually, and it's not safe because all the muck in the abdomen, you can't join the ends together when you cut out the bad bit. You bring both ends out to the surface, wait 6 weeks, 3 months for everything to settle down. Then the surgeon goes back in again and joins the ends up. So, so you can have temporary stomas and permanent stomas.
Now, every time we talk about medicine, I always think, which person thought, hey, I know, we'll cut it out. We'll stick it outside the body in a bag. How did someone think that? It blows my mind at the geniusness of that.
Indeed. Completely.
Because it's giving someone the ability to live. It's dealing with the problem. Because I'd be thinking, well, if it can't go nowhere, you're kind of dead. So that's bad. But then somebody else will be saying, hey, we'll just do it this way. We'll stick it in a bag.
We'll just collect it another way.
Yeah, that's probably the more polite way of saying it. Richard, thank you. I'm glad you're back because I've missed these chats because I know very little about medicine, as people will very quickly get, and I listen to you.
I think you know quite a lot about the heart.
Well, yes, I do quite. Yes.
Possibly too much, more than you wanted to know.
Yes, I have educated a couple of nurses who clearly didn't quite know or had a bit of knowledge, like, oh, no, that's not the truth. Trying to get ECG, and they were talking around like, no, that's not even close to the truth. So I have educated a couple, but it's knowledge though. I can get a bit of knowledge and then become a medical doctor because I've been on Google and watched House, but that's not quite the same, is it?
Very good.
Right, Richard, thank you. If you want to ask Richard any questions, you can do. Email us here, hello@pure247radio.org, hello@pure247radio.org. You can ask Dr. Richard Scott any questions on medicine or medical related stuff. And of course, you can read his amazing article in the magazine, which I've been editing recently. It's very good.
Good. Oh, thank you.
Right, Richard, thank you. God bless.
Cheers.